another dear friend, which is the Dr. Gabor Hermann, that is going to speak to you about a lecture that we wanted to call You Are Not Alone, because it's important that all the people like us taking care of the functions all over the world know that you are not alone. We are glad to introduce you also the Scientific Society of the IFUNA, that I think that most of you know, but for the few of one that do not know it, we will introduce to you this non-profit society that is also having a booth in the exhibit hall, and also speak to you about the concept of craniofacial functional medicine. So Dr. Gabor Hermann, that is joining us, I think, right now in the next few seconds, is right now the president of the IFUNA. IFUNA is the International Functional Association, that has been created more than 20 years ago, a little bit less than 20 years ago, by a wonderful team, led by a wonderful person that we are all thinking about right now, which is Michael Gormonos, that was passing away a couple of years ago, and that we are all having a big thinking. We could be thinking that after the loss of such a character, IFUNA could have been in troubles, but thanks to Gabor, we are not facing any troubles, and we are having the revival of IFUNA thanks to the new president, Dr. Gabor Hermann. I am letting you sharing your screen and start your lecture.
Hello, everyone. Thank you so much for the introduction, and thank you for this great organization. So actually, yes, I'm here. So I'm an orthodontist from Hungary, and I have the pleasure to present IFUNA to you. This is a day when we celebrate function, and well, the organizing committee was very successful, and thousands of people will look at these lectures, either live or just from recording. And we all come here to celebrate function, and the saying like form follows function, or at least we should say function and form are highly interconnected. And we can just appreciate the former lecture. They were very beautiful cases. And then we should ask the question, so why this knowledge, why this concept is not taught widely all over the world? And we have to assume that, especially from the orthodontic profession perspective, still there are three basic principles based on which the whole profession is operating. And this is the three statements. Like most of the things what we see mainly are genetic. So this is number one. Number two, we don't have to look beyond the craniofacial complex, because this, what we see, the malformation, the malocclusion, are local and isolated. So they have no connection to the entire body. And the third one is, when we state there is a malocclusion, it automatically comes with the statement that we have to fix it, because otherwise it leads to certain problems. And you know the list. So these are the three principles. And then when another idea comes to the scene, like wait, we should take function into consideration, this is always stated, this is not evidence-based. And the question is, what is evidence-based from these three principles? So the short answer is that if this was an evidence-based profession, we should be able to distinguish which is the best treatment for the one particular patient that we are facing to. And we are using the term orthodontics, but the reality is that from both the patient side and the professional side, there's a confusion. So like you can imagine, and you have experienced this kind of situation many, many times, that one particular individual, when goes to one dentist or one orthodontist, will get a treatment plan. And when it goes to the second place, there is a second treatment plan, highly controversial treatment plan. And when it goes on, like the patient goes to third and fourth, it can be even like 6 different treatment plans, depending on what appliance is used, depending what mechanics is used, depending on what treatment objective is used. So we still use the orthodontics as a term, but there is a huge variety of different treatment options, and we need to make it clear to the patients, but even for ourselves as well. So again, if this long specialty had been evidence-based, there wouldn't be any confusion in terms of how to select the best treatment option for one particular patient. So when it comes to genetics, even in the textbooks, we see that, yes, there is a hereditary and congenital factor, but the list is much longer than this. And we have to take the environmental factors also into consideration, because the most appropriate and politically correct question, and sorry, the answer to the etiology of malocclusion is that this is multifactorial, meaning that this is not mainly genetic. So there are different other factors that can alter or change the genetic information. So this is called epigenetics right now. So, so the first statement, this is just highly and mainly genetic, it is not true the way that we have been stating. And if this is like a multifactorial situation, what we see in the mouth, which have environmental factors in terms of the development. So this is not going to be isolated anymore, because the environmental factors are much greater, and it goes way beyond the craniofacial complex. So the second statement is not true anymore. And what about pathology? So if this is a multifactorial disease, let's say so, so there are certain factors that play a role in the development of this, and we cannot fix just a causal relationship. But the most politically correct statement, this is malocclusion and other problems like temporomandibular joint disorders are comorbidities, so not like a causative relationship. So these are very important statements. And then when it comes to the situation, how can we make a clear system to the patients, and how can we treat cases accordingly, and how can we help other colleagues to find the most appropriate treatment to the patient? So we have to go back to the treatment objective, because certainly there are different treatments, and there are different treatments philosophies, and the only way that we can distinguish is that we look at the treatment objective. And we don't have to invent the wheel again, but we have to look at the situation, what is going on, and what kind of treatments are existing. And there are three basic sub-treatment categories in the orthodontic specialty, and certainly one is called cosmetics. So it has been getting popular more and more since the arrival of aligners. And certainly this is the treatment category which does not take the bite into consideration and wants to align the social 6 anterior teeth. And that's fine. So if there is no direct consequence of malocclusion, and we cannot threat the patient that it is going to harm and cause any problem, so then it is fine to make a cosmetic treatment. So this is an agreement of the doctor and the patient. And the middle one, the second one, is the most common treatment category, which is like we don't pay attention on the environmental correction of the malocclusion. So we take the structures into consideration, either this is soft tissue, hard tissue, the teeth, and we just take the norms, the cephalometric norms, the cast norms, the soft facial or the soft tissue norms, and we try to achieve an ideal norm. So this is structure-based and norm-oriented. So this is the second category. And we have to get to the third one. So we have to distinguish the one that it is going to take the environment into consideration. And this is going to be the health-centered category, which is kind of new. But if we just collect the myofunctional, the neuromuscular, and airway centrics, all these existing schools, so they are gonna help the patient way more than just fixing the teeth and fixing the orofacial function. So they are helping the patient to sleep better, and ultimately this is gonna be health-centered. So this is gonna be the third treatment category that we can use to help both the patients and the profession as well. Then the question is, when we come together, the dentist and orofacial myofunctional therapists and breathing trainers and body workers, and we ultimately improve the sleep and help to prevent and treat chronic diseases, so then it is going to be more than airway centric. So this is going to be a new term, which is ultimately kind of medicine and craniofacial functional medicine. This is the term that we have agreed on in the IFUNA community, and this is the term that we are using in order to help the patients understand and the profession to understand what is going on when we come together and we help the patient. And ultimately, this is the way how we will be able to integrate the health-centered orthodontic profession or the sub-profession into functional medicine, ultimately. So these are the integrational levels or layers, how we will integrate health-centered functional orthodontics into functional medicine, because ultimately this is it. So this is functional medicine, a regional application of functional medicine. So this is the basic mission of IFUNA. So we have been very grateful to Michael Gorbonos, and he really started this mission alone, and he was very fantastic to keep this movement on for many, many years. And the people around Michael decided not to just let it go away, and then we just continued the mission. And we agreed upon this kind of message that this is going to be the great mission of the dissemination of craniofacial functional medicine. And the point is that, well, if you come together like people who are open-minded and who really believe and know and feel that the function is an important factor that we have to take into consideration. So the thing is that this community is rather small, and they are fragmented the way that there are sub missions. So we want to collect these kind of movements together and develop a common language, because this is the one which is the first level of the mission. And the second level is that we will establish a standardized diagnostic and documentation protocol in order to make multi-site research as possible, in order to compare later on those kind of treatment modalities which are taking place in the craniofacial functional medicine. So this is a great mission, a huge job, but this is the only way that we can help functional thinking people to operate either in a small remote place when they are alone, which is not able to make them able to collect different specialists into the board. And certainly we have to give recipes to those who are practicing in a great area where they have access to different kind of specialists as well. So this is IFUNA, and you are very welcome. So we are accepting applications as a member, and we will have the next meeting in Argentina in the fall, and we are happy to welcome you over there as well. But beyond that, we would like to continue this kind of mission. So by the conference, we will announce the 1.0 standardized protocol proposal to the members, how we should start document cases in order to have and collect information about FroggyMouth, for instance, and other treatment modalities that we can compare later on. So so this is IFUNA, and this is the mission, and thank you very much for the invitation, and thank you very much for giving an opportunity to IFUNA to introduce itself. And if you have any questions, certainly I'm happy to answer. So here we go. Thank you.
Thank you very much, Gabor, for this wonderful conference and the very important introduction of the IFUNA Association. You were very well speaking of the Congress that is arriving on next fall and the end of September, and that will take place in Argentina. Unfortunately, we will not have an online version of this Congress, but I think that it's a good way to remind to everybody that they can always use their office or credit card to travel to Argentina to be able to attend not only a great Congress of the IFUNA, but also the great Congress of the Argentinian Orthodontic Association that we are collaborating. And I think that it's very important for everybody that is getting interested about functions to know everything about the revival of IFUNA because that's also a very important part. When a society was having little moments like that of 1 year of non-activity, we are relaunching, as you said, a new dynamic with all the new ideas that you were putting in the society. And that's why there is the place for everybody that is having the will and the ideas to do stuff, to change everything for the functional world of orthodontics. It's a transdisciplinary association that is welcoming everybody. Maybe that you can also tell us a little bit more about all the different kind of practitioners that can join us, because we are having attendees that are dentists, orthodontists, of course. Most of you that are watching us right now, especially on this morning, that is a little bit focused on the orthodontics part, but we also have other kind of specialties.
Sure. Actually, once we accept the fact that what we see as structural malformation, and this is related to function, and function relates to sleep, and sleep relates to the general health. So, so the list is quite long. So actually, when we just take back and just look at this from the helicopter view, so this is about health. So functional medical physicians are also welcome. Health coaches are also welcome, and nutritionists and dietitians are also welcome. So actually, we are trying to make a full scope of people who are taking place in the improvement of the general health of the patient. And then we start to simplify the process in order to make it able to be practiced in a remote place. So actually, the one that if we know the great and general objective, this is general health. So then we can make a sub-objective for and every kind of field that it is like supporting health in general, like functional medicine uses the body balance, the psychosocial balance, the nutrition and detox and environment. So actually we can make the sub-objectives to these fields, and then we just break it down to the practicing specialties. So actually this is the job what we have been doing, and we start step by step. So the common language, so the terminology what we use is essential. And then the second is the objective, like the diagnostic and documentational processes. And then certainly we can start the filtration, which is the best in body posture change, which is the best in relieving the craniomandibular disorders and letting the jaw get to the center line without surgery. So actually we will compare different treatment modalities to just get a very powerful and yet simple process to our friends and the community.
And we're speaking about the briefing and the importance of the impact on the sleep. And I think that it's important also to thank our oldest members at the IFUNA, because sometimes it's the oldest members that are not the most open mind in general about the transdisciplinary way of working. And it was really supported and almost brought by some of our almost members. I am thinking about Roger Price in Australia, that is giving a big focus on the briefing. Also thinking of Barbara Bimmler in Germany, that is one of the oldest functional pioneer in Europe and also in the world, and that we're helping us to develop this approach. I am saying we because I have to say that I am thanks. I'm glad to be part of their board member with you, Gabor, and it's a great pleasure. So that's why, if you are enjoying the Congress that you are seeing right now, you can really join us in the Congress in Argentina, and we will be so glad to welcome you there. There's also, by the way, other IFUNA speakers that will be speaking today, but we will be speaking about that a little bit later. I think that to finish about that, maybe that Gabor, you can also tell us a little bit more on what will be the process that any members that would like to join the IFUNA would have to do to join us and share his idea with us.
We have to be very honest. So this is a, well, on the one hand, it is 20 years old association, but to be honest, we are in the registration process at the moment, and the website is open. Website is fully done. You can fill out the registration form. The membership is free of charge, but apologize for the baby steps. And the thing is that we are collecting applications. We will respond and we will keep them informed. the first official event is going to be the Argentina event, but in the meantime we will go and work with different representative of specialties to just develop this seed proposal of documentation and record takings. So by September we will be ready with the first proposal. In the meantime, we will inform you. I don't promise that we start the newsletters on a regular basis, but we will just do our best. So most of you see you in Argentina. Hopefully we'll be able to do something virtually before that, but we have great plans and few people. So please join and help this movement. So I promise that we will keep you informed.
Thank you very much for saying that, because I think that right now it's, as you said, the revival of a very old association that is having such a legacy. When IFUNA was created, they were really having the idea of taking the people in every country that was having the most precise, the most developed functional way. And it is this legacy that we are trying to keep and maintain. So just as a last information for everybody that would like to know, the website is getting in developments. And there is the IFUNA booth that is available in the exhibit hall right now, that Gabor will be there to answer all your questions. And as for the other lectures, there's going to be a Facebook post of the lecture of Gabor, where he will be able to answer all the questions that you might have. I am not seeing you anymore at my side, Gabor, but I know that in my heart, you are at my side. So in a way, even if you are not there, we are still side by side. Thank you so much, Gabor, for having joined me and joining us for this Congress. And we see each other very soon.